Dr. Steve, master of the subconscious mind and doctor who fixes 100% of orthopedic issues not related to cancer, fracture, infection. And when you read a label on glucocorticosteroids, it'll say prolonged use leads to insulin resistance. It leads to heart disease. It leads to diabetes, etc. And the thing of it is, with that, you have to understand that those glucocorticosteroids are a mimic of actual cortisol in our bodies. And so it's the cortisol that causes the breakdown of tissue, right? We can actually get ligament and tendon joint issues from having elevated cortisol. And there's several ways that we need to address high cortisol. One of them is through diet, and people want to blame eating processed sugars as the culprit when it is not. It's actually linolenic acid. It's polyunsaturated fatty acids that are damaging the mitochondria in the gut. So what happens is when you consume these foods that are high in linolenic acid, these polyunsaturated fatty acids, they become peroxynitrate and they damage that mitochondria, and your gut can't absorb the glucose any longer. So it creates systemic inflammation. High cortisol levels, again, you're going to cause insulin resistance and diabetes. You're going to cause heart disease. You're going to cause mood disorders. You're going to cause poor joint. You're going to create joint issues for yourself. Tendons and ligaments get weak, right? It breaks down tissue. So we need to get rid of all the seed oils, the canola oil, safflower oil, sunflower oil, soybean oil, and such, right? And it includes getting rid of the chicken that's fed the seeds and grains, because chicken is one of the highest sources of linolenic acid. But also, what else causes high cortisol, right? It's our chronic exposure to stress. So we're constantly bombarded with chemicals in the environment. We're chronically being hit with blue light from our incandescent lighting inside, right? So we need to make sure we're getting sunlight and red light. You can wear blue light blocking glasses, exposure to EMFs. We have voltage gated calcium channels in the skin that pick up the reception and cause the release of peroxynitrate, cause the same damage of the seed oils. Peroxynitrate is that culprit. So those are stressors, but also the subconscious mind. The subconscious mind is 98% of our thought and creating the reality in front of us. So the things that you have internalized, denied, and disconnected from, and put them in the back of your mind, hoping that the problem just goes away, that just basically ends up remanifesting in as the reality in front of you over and over until you learn the lesson, are the things that are creating high cortisol as well. So we have to look at things emotionally. We have to look at things biochemically, as in the foods we eat and the environment around us. And we have to look at our structure, which is the tension on the brainstem that most other healthcare practitioners aren't addressing properly. The bones are stuck forward in a position the muscles can't self-correct. So your body has collapsed and created these adhesions on the cord, and you have to pull those apart and slacken the cord so we have proper posture and alignment. So we're decreasing the amount of stress we have on our physical structure. So when we address things completely and wholly, emotionally, biochemically, and structurally, you fix 100% of orthopedic issues not related to cancer, fracture, infection.